10 things your feet say about your health. Want to make a simple 10 seconds check on the state of your health? Sneak a peek at your feet. You can detect everything from diabetes to nutritional deficiencies just by examining the feet. The lonely left and right provide plenty of insightful data. Together they contain a quarter of the body's bones. And each foot also has 33 joints, 100 tendons, muscles and ligaments, and the countless nerves and blood vessels that links all the way to the heart, spine, and brain. Unresolved foot problems can have unexpected consequences. Untreated pain often lead a person to move less and gain weight, for example, or to shift balance in unnatural ways, increasing the chance of falling and breaking a bone. So when the feet send one of these 10 warning messages, they mean business. 10 things your feet can tell you about your health. 1. Toenails with slightly sunken, spoon-shaped indentations. What it means? Anemia, iron deficiency, often shows up as unnatural, concave or spoon-like shape to the toes. Nail beds, especially in moderate to severe cases. It's caused by not having enough hemoglobin or iron-rich protein in the blood cells that transport oxygen. Internal bleeding, such as an ulcer or having menstrual periods, can trigger anemia. More cues. On fingers as well as toes, the skin and nail beds both appear pale. The nails may also be brittle and feet may feel cold. Fatigue is the number one sign of anemia, as are shortness of breath, dizziness when standing, and headache. What to do? A complete blood count is usually used to diagnose anemia. A physical exam may pinpoint a cause. First step treatments include iron supplements and dietary changes to add iron and vitamin C, which speeds iron absorption. 2. Hairless feet or toes. What it means? Poor circulation, usually caused by vascular disease, can make hair disappear from the feet. When the heart loses the ability to pump enough blood to the extremities because of atherosclerosis, commonly known as hardening of the arteries, the body has to prioritize its use. Hairless toes are, well, low on the totem pole. More cues. The reduced blood supply also makes it hard to feel a pulse in the feet. Check the top of your foot or the inside of the ankle. When you stand, your feet may be bright red or dusky. When elevated, they immediately pale. The skin is shining. People with poor circulation tend to already know they have a vascular condition, such as a heart disease or a carotid artery, yet may not realize they have circulation problem. What to do? Treating the underlying vascular issues can improve circulation. Toe hair seldom returns, but nobody complains much. 3. Frequent foot cramping. Charlie horses. What it means? The sudden stab of a foot cramp, basically the hard contraction of muscle, can be triggered by fleeting circumstances, such as exercise or dehydration. But if it happens often, your diet may lack sufficient calcium, potassium or magnesium. Pregnant women in the 3rd trimester are especially vulnerable thanks to increased blood volume and reduced circulation to the feet. More cues. Charlie horses tend to rear up out of nowhere, often while you are just lying there. They can be single-shaped muscle spasm or come in waves. Either way, soreness can linger long afterward. What to do? Try to flex the foot and massage the painful area. You may also be able to relax the muscle by applying a cold pack or rubbing alcohol. To prevent cramp, stretch your feet before you go to bed. Then drink a glass of warm milk for the calcium. 4. A sore that won't heal on the bottom of the foot. What it means? This is a major clue to diabetes. Elevated blood glucose level leads to nerve damage in the feet, which means that minor scrapes, cuts, irritations caused by pressure or friction often go unnoticed, especially by someone who's unaware he has the disease. Untreated, these ulcers can lead to infections, even amputation. More cues. Oozing. Foul-smelling cuts are especially suspects because they have probably been there for a while. Other symptoms of diabetes include persistent thirst, frequent urination, increased fatigue, blurry vision, extreme hunger, and weight loss. What to do? Get the ulcer treated immediately and see a doctor for diabetes evaluation. Diabetics need to inspect their feet daily. Older people or the obese should have someone do this for them and see a healthcare professional every 3 months. 5. Cold feet. What it means? Women especially report cold feet, or more precisely, their bedmates complain about them. It may be nothing or it may indicate a thyroid issue. Women over 40 who have cold feet often have an underfunctioning thyroid, the gland that regulates regulates temperature and metabolism. Poor circulation in either gender is another possible cause. More cues. Hypothyroidism symptoms are pretty subtle and appears in many disorders: fatigue, depression, weight loss, dry skin. What to do? Insulating layers of natural materials work best for warmth. Think wool socks and lime boots. If you also have other nagging head complaints, mention the code fit to your doctor. Unfortunately, however, aside from treatment with medication in the event of a thyroid condition, this tends to be a symptom that is neither easily nor sexily resolved. 6. Thick, yellow, downright ugly toenails. What it means: a fungal infection is running rampant below the surface of the nail. Onychomycosis can persist painlessly for years. By the time it's visibly unattractive, the infection is advanced and can spread to all toenails, including fingernails. More cues. The nails may also smell bad and turn dark. People most vulnerable: those with diabetes, circulatory trouble or immune deficiency disorders, like rheumatoid arthritis. If an older person has trouble walking, sometimes the problem can be traced to the simple fact that as infected nails grow thicker, they are harder to cut and simply go ignored to the point of pain. What to do? See a foot specialist or your regular physician for care and treatment. In serious cases, over-the-counter antifungals are usually not as effective as a combination of topical and oral medications and the professional removal of diseased bits. Newer generation oral antifungal medications tend to have fewer side effects than older ones. 7. A suddenly enlarged, scary-looking big toe. What it means? Probably gout. Yes, the old-fashioned sounding disease is still very much around, and you don't have to be over 65 to get it. Gout is a form of arthritis, also called gouty arthritis, that's usually caused by too much uric acid, a natural substance. The build-up uric acid forms in needle-like crystals, especially at low body temperatures, and the coolest part of the body, farthest from the heart, happens to be the big toe. 3/4 of the time, you wake up with a red-hot swollen toe joint as the first presentation of gout. More cues. Swelling and shiny red or purplish skin, along with a sensation of heat and pain, can also occur in the instep, the Achilles tendon, the knees and the elbows. Anyone can develop gout, though men in their 40s and 50s are especially prone. Women with gout tend to be postmenopausal. What to do? See a doctor about controlling the causes of gout through diet and medication. A foot specialist can help relieve pain and preserve function. 8. Numbness in both feet. What it means? Being unable to feel your feet or having a heavy pins and needle sensation is a hallmark of peripheral neuropathy, a damage to the peripheral nervous system. That's the body's way of transmitting information from the brain and spinal cord to the entire rest of the body. Peripheral neuropathy has many causes, but the top two are diabetes and alcohol abuse, current and past. Chemotherapy is another common cause. More cues. The tingling or burning can also appear in hands and may gradually spread up to the arms and legs. The reduced sensation may make it feel like you are constantly wearing heavy socks or gloves. What to do? See a physician to try pinpoint the cause, especially if alcohol addiction does not apply. There is no cure for peripheral neuropathy, but medications from pain relievers to antidepressants can treat symptoms. 9. Sore toe joints. What it means? Rheumatoid arthritis, RA, a degenerative joint disease, is often first felt in the smaller joints, such as the toes and the knuckles of the hands. More cues. Swelling and stiffness usually accompany the aches. This pain tends to be symmetrical. For example, it happens simultaneously in both big toes and in both index fingers. ROA develops more suddenly than degenerative arthritis, and attacks may come and go. Women are almost 4 times more affected than men. What to do? A full workup is always needed to pinpoint the cause of the joint pain. For ROA, there are many medications and therapies that can minimize pain and preserve function, though early diagnosis is important to avoid permanent deformation. In the feet, the toes can drift to the side. 10. Pitted toenails. What it means? In up to half of all people with psoriasis, the skin disease also shows up in the nails as many little holes, which can be deep or shallow. More than 3/4 of those with psoriatic arthritis, a related disorder that affects the joint as well as the skin, also have pocked pitted nails. More cues. The nails, fingers as well as toes will also thicken. They may be yellow-brown or have salmon-colored patches. The knuckle nearest the nail is also likely to be dry, red, and inflamed. What to do? A variety of medications can treat both psoriasis and psoriatic arthritis and can restore the nail bed surface in many cases, especially if treatment begins early. The big takeaway: While most likely your symptoms will reveal something benign, it's good to keep an eye on your feet. Be kind to those hardworking body parts. They just might have something important to tell you. Hi, thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more contents like this, kindly like, share, leave a comment in the comment section, and also please subscribe to this channel if you have not already subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.